All right, let's get into it. Today, we're going to try and make sense of the mental health landscape in America. And it's incredibly complex. We're going to look at just how big this challenge is, what's getting in the way of people getting help, and then explore some of the really innovative ideas that are pointing a way forward. Okay, let's dive in. So, to really wrap our heads around the scale of this, we have to start with this one number: 60 million. That's not a typo. According to the latest data from Mental Health America, 60 million adults in the US dealt with a mental illness just in the last year. I mean, that's a staggering number that touches literally every single community across the country. And that number immediately brings up the big question, right? The one that really drives this whole conversation. If tens of millions of people are struggling, why is it still so unbelievably hard to get help? It's not a simple question with an easy answer, but it's the one we've got to dig into if we're ever going to find a way forward. So here's how we're going to tackle it. First, we'll get a real snapshot of the data. Then, we're going to look at why the counseling profession itself is kind of stuck at a crossroads. After that, we'll see how good programs actually get built from the ground up. And finally, we'll take a peek at the future of care. Okay, so let's start with that big picture. What is the data actually telling us about where we are with mental health in the nation right now? So when you break that huge 60 million number down, you start to see the different pieces. And what's wild is how much they overlap. In 2024, almost a quarter of all adults had some kind of mental illness. Nearly 18% were dealing with a substance use disorder. And this one's tough. 5.5%, that's over 14 million people, had serious thoughts of suicide. And remember, these aren't separate boxes. For so many people, these issues are all tangled together. And this is absolutely not just an adult problem. The impact on young people it's just profound. We're talking about 2.8 million kids and teens whose depression was so bad it got in the way of everything: school, home life, friendships. This is so much more than just teenage angst. This is a serious roadblock right at the start of their lives. So here it is. This is the disconnect. This is the gap between the need for care and actually getting it. I mean, look at this. A jaw-dropping 77% of adults with a substance use disorder got no treatment at all. And 1 out of every 4 adults with any mental illness said they needed treatment but couldn't get it. This isn't just a little crack in the system, you guys. This is a chasm. So why? Why is that chasm there? Well, it's not as simple as we just need more therapists. A huge part of the problem is actually baked into the system itself: deep, systemic hurdles within the mental health profession. This line from a briefing document just nails it. It really captures this tension perfectly. You've got this growing army of skilled, passionate professionals who are ready to help, but at the same time, they're being held back by the very system they work in. It's like the profession has one foot on the gas and the other slammed on the brake. And one of the biggest breaks is this thing called scope of practice dissonance. Okay, it sounds super academic, I know, but trust me, its impact in the real world is massive. All it really means is that what counselors are taught to do in school and what the law in their state actually allows them to do are often two totally different things. And here's a perfect example. Counselors spend years learning how to make independent diagnoses using the DSM, which is the standard manual. But then they might get their license in a state where the law basically says, yeah, sorry, you're not actually allowed to officially diagnose anyone. So for you, the person looking for help, it means the pool of people who can help you is artificially smaller, which leads to longer waits and more red tape. It just doesn't make sense. And that's just one piece of this messy puzzle. The whole system is fragmented. The rules for getting a license are a total patchwork that changes from state to state. The profession hasn't been able to secure Medicare provider status, which locks out millions of seniors from care. There's no single powerful voice advocating for change. And you've even got these old, outdated grandfathering rules that can weaken professional standards. It's a mess. Okay, so with all of those huge systemic problems, you might think nothing good could ever get built. But it can, and it does. It just doesn't happen by accident. It takes a really deliberate, step-by-step process. A flowchart like this really shows you that effective programs aren't just about a therapist opening up an office. It's about designing an entire system, from figuring out what a community actually needs, all the way down to managing the program and proving that it works. It is an intentional and, pretty complex process. And a huge piece of that puzzle is money. And getting money often means writing grants. It's not glamorous, but it is so essential. And it's not magic. It's a methodical checklist. You have to clearly show what the problem is, have a rock-solid plan with goals you can actually measure, and a budget that makes sense. This is the hard, behind-the-scenes work that turns a good idea into actual help for people. So if that's the groundwork being laid right now, what's next? Where is all of this headed? Let's look at some of the new models and theories that are really lighting a path forward. One of the biggest shifts is towards something called integrated care. And this table just lays it out so clearly. The old way was a separate mental health clinic, which, let's be honest, can feel stigmatizing. The new way is putting mental health care right inside your regular doctor's office. This makes it normal, it treats the mind and body as the connected system they are, and get this, it can even cut costs by 20 to 30%. It's just common sense, especially when you realize that most visits to a primary care doc are actually driven by psychological issues. And it's not just the how of care that's changing. It's our whole understanding of why therapy even works in the first place, and that is being totally revolutionized by neuroscience. We're entering this era of neurocounseling. It's giving us the hard science behind healing. It's based on mind-blowing ideas like neuroplasticity, the fact that your brain can literally rewire itself based on new behaviors and experiences, or epigenetics, which shows that your environment can actually turn certain genes on or off. This is real science proving that change is possible. And that really brings us to this quote, which is so powerful. The profession is being invited to live up to the theoretical base it professes. It's basically a challenge. It's saying, look, we know how many people are in need, we know what the barriers are, and we now have the science to back up what we do. The invitation is for the profession to come together and turn all that knowledge into real, tangible help for those 60 million people. So we end up kind of back where we started, but with a totally new question. The way forward, through smarter systems, stronger advocacy, and amazing new science, it's getting clearer every day. But the final question isn't just for the professionals. It's for all of us. Is the collective will there to finally truly build the mental health care system we so obviously and desperately need?